Hello and welcome dear viewers to the video on critical process parameters and critical process parameters or CPP. These are the QBD elements. One of the QBD element is CPP, and these CPPs we are going to understand in detail. So let's start with the video. See, the manufacturing processes involves the steps or series of actions which collectively make the process. So first we have to understand what is process, what is unit operation, what are process parameters, and then we can understand the critical process parameters. It is a part of QBD, and for critical process parameters the initial risk assessment is done, and based on that risk assessment the critical process parameters are evaluated and studied. Then there is a risk ranking for the CPPs that may be low, medium or high, and based on that risk ranking the studies are performed. So process is a series of action, you can say, or the steps, series of steps to make something happen or to prepare something, and this process involves the steps to prepare or make something. It may be called as a procedure or a recipe. So you can understand from a simple process of making juice. So for making a juice you need the fruits, you need water, you need mixer, you need sugar. So these are the materials, and then you go to make the fruit juice. Then comes to the unit operation. Unit operation is a single step in series of process steps. So process is made up of a number of unit operations, and unit operation is a single step, like mixing sugar in the juice. So this process of mixing the sugar into juice becomes a unit operation. That means mixing process becomes the unit operation in the process of making a juice. Then series of the actions or steps will be there, that will be known as procedure or process for making the juice. Then process parameter. So process parameter is a variable or such a variable or parameter in of the process which you can measure, and the variability of that process parameter will affect the end product or end outcome. Mixing time of the mixing sugar into the juice is one of the process parameter, and if this process parameter is varied, if you mix the sugar into the juice for a very less time, then mixing will not happen. If the mixing time is insufficient, then sugar may not get mixed and the juice will taste bad, or the juice may not taste good. So taste is the CQA of the product, that is juice, that is a critical quality attribute, and mixing time is the CPP. So now you might have understood that if you vary the critical process parameter, it will impact the final outcome or the quality attribute of the product. Then the critical process parameter. Now you know the process, you know the parameter, and now the critical process parameter. So these are the parameters which have a great impact onto the performance of the process and drug product CQS. Now, if you see the pharmaceutical manufacturing, then critical process parameters are those parameters which impact the performance of the process and the drug product CQS. The process parameters may have high, medium or low risk for the process and the product. Suppose you are working on a direct compression type of tablet formulation and you are going to mix the materials together. That time the mixing time will become the critical process parameter, and if this mixing time is too less or too high, then there are chances of failure of the blend uniformity, and the blend uniformity will have impact onto the content uniformity. See, scientific understanding is required for the understanding of the CPPs. Not all the parameters are critical, and not all the parameters will be not critical. So some parameters will be critical, some parameters will not be critical. And thorough understanding of the drug product CQS, thorough understanding of the critical material attributes and the process will help you to understand what are the CPPs for the product. CPPs are those parameters which, if changed or varied, then result into a change in the quality of output material or product critical attributes. Just I have said regarding the direct compression type of process, and mixing time or blending time is the critical process parameter which have impact onto the blend uniformity, and it will in turn have impact onto the content uniformity. So if the mixing time is changed, it will result into change into the CQA, that is CU. So it is a critical process parameter. Now, how to identify the critical process parameters? So as per ICH guideline Q8R2, that is the guideline from ICH for pharmaceutical development, and as per this ICH Q8 guideline, the critical process parameters are defined. So as per ICH, a process parameter whose variability has an impact on a critical quality attribute and therefore should be monitored or controlled to ensure the process produces the desired quality. So in a very simple meaning, these are the parameters or process parameters which have great impact onto the product quality, and those parameters are called as critical process parameters. Now we will see what is the link between the QBD elements, CQA, CPP and control strategy. So CQAs are the critical quality attributes of the product, and those critical attributes are linked to the CMAs and CPPs. So CMA, that is critical material attributes, and critical process parameters are having the impact onto the CQAs. That's why control strategy is required on the CMA and CPP for achieving the CQA. If your CQA is content uniformity, then the material attributes and critical process parameters are required to be controlled. So this is the link between the QBD elements. Now the powder mixing process we will see. in the pharmaceutical manufacturing. And the example I will take for the DC type of process for making the tablets. So direct compression process involves the powder mixing. The powder will have different materials like API will be there, diluents will be there, disintegrants will be there, lubricants will be there, and all these materials will be mixed into a blender. That equipment is called as blender, and the process is called as blending. So powder mixing is done by blending unit operation in pharma for manufacturing of oral formulations. The equipment is called as blender, and the main critical process parameters will be order of loading the materials into the blender. Many of the pharmaceutical professionals know about the sandwich blending. Sandwich blending means the materials are loaded layer by layer, and the material which is having very low concentration or very low level, that is kept in between the two layers of the higher level material. Generally these are the APIs, and then these are blended together or mixed together. So order of loading the materials into the blender becomes the critical process parameter. And if it is a critical process parameter for the blending process, then it is required to be controlled, and clear cut instructions should be there into the manufacturing record. Then comes to the rotation speed. So how these materials are blended into the blender is by the rotation. So it rotates and it mixes the material. That rotation speed is critical. It should not be too low or it should not be too high, and it is dependent onto the performance qualification and the equipment size. Then number of revolutions. So based on the rotation speed, the RPM per minute is calculated, and from that RPM the number of revolutions are calculated. Then blender RPM and mixing time. So if you rotate the blender at 10 RPM and you blend the material for 3 minutes, it will become 30 revolutions. Either you denote 30 revolutions or you denote RPM and the mixing time. These are the same thing. These things are dependent onto the scale. That means if the blender is small, then the rotation speed will be higher. And once the scale is there, that means if you increase the batch size, if you take the bigger blender, the rotation speed will be less. This calculation is done for scaling up the blending process, and that calculation give you the specific rotation speed and the mixing time. That is calculated by the tip speed or the Froude number. That I am not going to discuss in detail here because it is a time consuming and critical to understand type of terminology. But simply for this video you understand that the speed of the rotation and the time are the very critical process parameters. Then occupancy, that is fill level. If you completely fill the blender, then mixing will not happen because it requires some space so that the material moves inside the blender and mixing happens. Then is the hold time. Hold time means how much time you are keeping the material inside the blender or inside the bin. Then CPP is for the blender can be studied by OFAT trials or by the DOE trials. So OFAT trials means one factor at a time. Either you study the occupancy at a time, either you study the rotation speed, or you study the mixing time. And sometimes the more statistical approach is taken by doing the DOE studies for blending and lubrication. So CPPs are those parameters which are critical for the CQA achievement. That's why these are known as CPPs. So these CQAs are affected by the CPPs. If critical process parameter is varied, it will have impact onto the CQAs. So if you understand the CQAs affected by blending process, these CQAs will be blend uniformity. That means uniformity of the content in the blend or blend homogeneity. The blend is homogeneous or not, that will be affected by the blending process. Then blend flow. Many of the time the material does not have good flow, and to improve its flow the lubricants, glidants are added, and the blend flow will be affected by the glidants, lubricants levels, and also the mixing time. So these are the important CQAs of the product which are affected by the CPPs of blending. So blend uniformity will have impact onto the CQA like content uniformity. Also blend flow will have impact onto the content uniformity. So the content uniformity is the ultimate CQA, and it is governed through the blend uniformity and the blend flow. Also the CPPs may be scale dependent or may be scale independent. So whenever there is a scale up, that time the critical process parameters which are scale dependent are studied in detail. Also CPPs are required to be controlled from the initial product development. Risk assessment is required to know the CPPs. So this is regarding the critical process parameters. It is a QBD element, and as per the ICH QBD guideline, the pharmaceutical development report or product development report should involve the risk assessment and the complete studies to know the impact of CPPs onto the drug product CQAs is required. And finally, CPPs are scale dependent, and also some of the CPPs are scale independent. So this is regarding the critical process parameters. I hope you might have got good understanding about the critical process parameters from this video. Please share these videos with your friends and colleagues and professionals so that they will have good understanding about these terminologies. Thank you for watching the video. Please do like, share and subscribe to this channel. Thank you.